Our next and final speaker is Dr. Michel Bergeron. Have you ever wondered if you really needed a prescription? Worried about whether you were resistant to antibiotics? Or did you have to wait for days for your test to come back to get the right treatment? Well, Dr. Bergeron is the 2016 recipient of the $100,000 Manning Principal Award, and he is battling antibiotic resistance with his innovation, Rapid 1-Hour Molecular Diagnostics for Better Care. Now, that identifies microorganisms using their DNA, allowing physicians to prescribe antibiotics with precision in real time. This rollerblading cross-country skiing Dr. Bergeron will show you how his dream became a reality. Dr. Bergeron.
Good morning. What I would like to share with you today is my 30 years experience in trying to breaking silos between different specialties and trying to put product on the markets. On the 21st of September 2016, the United Nations made a declaration signed by more than 150 countries on antibiotic resistance. That antibiotic resistance is one of the greatest threats that the world is facing, as it is estimated that 800,000 deaths worldwide are associated with resistance, and that rapid diagnosis is an important solution to better control the use of antibiotic and thus their resistance. For me, this is great news, as I have been working on this problem for more than 30 years. Today, I would like to share with you my vision of the importance of using DNA-based tests to accelerate the diagnosis of infectious disease, and will present to you the path of our innovation cycle that you see on the slide to develop rapid, less than 1 hour molecular diagnostics that are now revolutionizing the practice of medicine. When I came back from Boston in 1974, there was no infectious disease at Laval University. There was no research in infectious disease in our university. Moreover, there was no specialty of infectious disease in Canada. And it was the reign, the domination of antibiotics. I had the privilege to work on new antibiotics for the first 15 years of my life. And I've realized that every time we've put in new antibiotics, the microbes that are 4.2 billion years have adapted very rapidly. And I've asked myself, why so much resistance? And the answer came very rapidly as I saw myself over-prescribing and trying to look for the magic bullet that could cure any infectious disease. So it was the empirical use of broad-spectrum antibiotics, which everybody was using, even the specialists. Why such inappropriate use of antibiotics? I've asked again myself. Well, mostly because of slow microbiology tests. Here you see that pasture microbiology is extremely slow. It takes from 2 days to several weeks to identify microbes because we're using culture. It takes a long, long time. But in 1985, I dreamed of using DNA to accelerate the diagnosis of infectious diseases. And as you can see, Pasteur smiling at this new invention, DNA over culture. And I'm sure if Pasteur, who is my hero, would be here today, he will be working on DNA. So I dreamed that it would completely transform the practice of medicine. As you will see, it did. So my dream was really to find specific bacterial DNA sequence for diagnostic. Here you see the inside an Escherichia coli, a very common infection, common microbes that cause severe infections, and that is becoming more and more resistant to antibiotics. But developing, in 1985, developing rapid testing posed many challenges. There was no sample preparation and rapid DNA extraction. That was the first challenge. The second, there was no extensive genomic platform. And third, there was no rapid and appropriate amplification detection platform or instruments. So we were really in the dark. So I got people to work together towards those several goals. And as you see here, a very simple method, which we call RUCLANAP, which allows the extraction of DNA, crack open the bacteria so we can get the DNA, and it takes less than 10 minutes. Here you see our genomic platform. On the left, you see Maurice Boissonneau holding a 17-pound patent with 1,500 pages of knowledge. And in the center, you see this phylogenetic tree to really be able to identify most microbes. And most of all, the most important ingredient of our discovery was people. When I came, there was no research. Today, there's more than 200 people working in infectious disease at Laval University. And where you see the circle around their head are the people who have been working with me for the last 30 years on antibiotics and also on rapid diagnostics. So in '95, I decided to create a company. Now at that time, creating company was not à la mode, especially in Canadian University. But I believe we had sufficient intellectual property, and the company started in 1995. I had to hire a president because I always stayed in the academic milieu, but I was chairman of the board, and I was there as a watchdog to ensure that my vision would continue. And finally, in 1997, a new technology came out, which is real-time PCR, to amplify and multiply in thousands and millions of copies the DNA. And we partner with CIFID, which IDI and CIFID made a company called Iridia, which was extremely successful. They had problems because they had no tests. They had a machine with no tests. Us, we had tests without a machine. It was the perfect marriage. And 2 years later, we published in the New England Journal of Medicine the first demonstration that you could identify a microbe directly from a clinical sample in less than 3/4 of an hour, from 30 to 45 minutes. The first test was detecting group B streptococci, a microbe that is found in the vagina of women, and it is the first cause of neonatal meningitis. And we could do it in the obstetric room, thus allowing the physician to prescribe antibiotic, and before delivery, having the possibility to neutralize the microbes and preventing meningitis in the children. 2 years later, this test was approved by the FDA and also by Health Canada. And if you look at the bottom in yellow, the FDA said that it could be used instead of standard culture. This was my dream. We were the first to demonstrate this. Thereafter, we developed many other tests to detect antibiotic resistance in methicillin-resistant Staph aureus. Also, we detected rapidly C. difficile, who's a great killer, which kills 30,000 individuals in the US each year, and many other tests. And the socioeconomic impact of our rapid molecular on patient and healthcare system are numerous. Precise diagnosis, treatment of infections in real time, better control of resistance, better control of epidemics, and finally, as you might know, healthcare-associated infections are the biggest killer. In reality, 2 million people die of septicemia, which is a hospital-acquired infection, a year. It lowers healthcare costs, it gives safer environment, it improves the quality of life, and saves lives. Also, the economic impact was great. In 2006, we sold to Becton Dickinson because we couldn't reach the market. And this was a major problem we had. And so they bought us in 2006, and in 2008, they built a BD manufacturing center, and 2010, a research center. Investment of more than 800 million over the last 10 years, 350 highly qualified personnel. And our products are sold in 50 countries. In conclusion, stat-DNA-based microbiology is here. It's already revolutionized the practice of medicine. But I found that the major obstacle that I've seen during my career was breaking silos, to get people working together. As a matter of fact, when we developed our assay, it took 1.5 years for those people working together to transform our invention into products. Another obstacle was the change in culture without culture. And this was really difficult, this change in culture without culture, because our tests were not adopted. And even today, many of these tests are not on the market. They're on the market, but they're not taken up by microbiology laboratory. So what I've learned also is that perseverance and keep your ideas and your focus all those years and never let go is the solution. Thank you.